Hello, my name is Mackenzie Pirtle, and today I'm going to be talking about mentorship and nursing leadership. The pico that I formulated for this topic is, with newly hired nurses, what is the effect of mentorship programs compared to no on-the-job training on quality of patient care within the first year? Course objectives that I have chosen for this presentation to meet are 2, 3, and 4, which are demonstrating nursing leadership principles to plan and implement patient safety and quality improvement initiatives within the context of dynamic, complex healthcare system and interprofessional care. Apply concepts of global health to plan appropriate culturally safe care and health promotion for vulnerable populations. Utilize the best current evidence and systems thinking to improve nursing and healthcare practices for groups or populations. The course outcomes that I have chosen for this project are: the student will correctly examine standard teachings, impact on safety provided by a mentorship program. Following the completion of this presentation, the listener and the student will accurately identify the standard characteristics of a mentor. The student will analyze the differences in nursing practice from those without a mentorship program versus those who participate in a mentorship program. So I have a mentorship program in place. Well, there's many reasons defined by the American Nurses Association this year. They are displaying support for ongoing learning, conveying the organization's willingness to embrace change, improves nurse recruitment and retention, provides succession planning that ensures an understanding of a company's history and mission, promotes enhanced teamwork by emphasizing overall goals. It contributes to high quality patient care and better patient outcomes, and identifies and nurtures future nurse leaders. So the impacts of practice for the mentor of the mentorship program. So it increases the mentor's quality of care, their patient safety, nurse leadership opportunities for the mentor themselves. It re-energizes their passion for nursing, since some nurses do get burnout in the line of duty. They obtain honest feedback in current policies and procedures. They gain a fresh perspective on the latest nursing trends, evaluate your communication skills to determine what's ineffective, confusing, and misleading by the student. They assist in developing another nurse's career while they develop their own. They give back to the next generation of nurses and contribute towards a positive work culture, since they can help mold the new nurse into the type of nurse needed for the unit. Impacts on practice for the new nurse. The new nurse can then provide safer care. They have helpful oversight. They can obtain easier career advice from their mentor. They develop critical thinking skills and clinical skills. They enjoy more career satisfaction. They receive ongoing direction, support, and advice. They gain insight into a nursing role or specialty. They expand their professional network by getting to know more nurses and managers quickly, and reduce stress associated with transitioning roles. Mentorship versus having no mentorship system in place or no workplace training. According to Al-Harbi et al. 2023, the biggest concerns that they found with their study was new nurses had difficulty dealing with the health system, especially those who had not worked in healthcare before. It was a different kind of setting for them to understand. There was a lack of training on medical devices in the work environment, which can add stress and increase time it takes to do tasks. There was a fear in dealing with new patients, since they never knew what they were walking into and did not have any backup to help them. There was a difficulty in applying policies and procedures in the workplace, especially when they did not have training on where to find the policies and procedures. So there's definitely a need for a mentorship program, because all of these would be alleviated if they were having a mentor. Here's some statistics found by Ugarte Ronaldo et al. They said that There is 4.3 million active registered nurses in the United States. The first year nurse turnover rate ranges from 13 to 35%. Of those, 66% of nurses reported feeling burnout. When they studied the effects of a mentorship program, they noticed that new nurses intending to leave the job within the first year that did not have a mentorship program was 63%. When there was a mentorship program in place, it went down to 47%. That is a significant decrease and just is another way to represent the need for mentorship programs in healthcare. So where can I find a mentor if I were a new nurse? You can look for various places. When you're going through nursing school, you can always request a mentor through your college. Many colleges have a mentorship program, kind of like a Big Brother Big Sisters type situation. And you can also always do job shadowing in a place that you plan on working. That'll get you more familiar with the environment, and you can start making connections with people that can kind of take you under their wing. Once you're hired on, you can talk with the unit manager or supervisor about obtaining a mentor within the first few weeks of hiring, as well as the human resource department. They have it in their bundle when they hire you. That's what my workplace did for me, is they immediately set me up with a mentor before I even took my boards. So the role and function of the nurse leader, this would be the mentor. So they can sometimes assign themselves to the student. Other times the nurse leader is in the role of the manager. So they oversee the mentor, they assign the mentor, which would be another nurse on the unit, to the new nurse. And then together the manager and the mentor would assess the student's readiness, the length of their mentorship, and what is appropriate patients to assign to the new nurse at this time. Collaboration with nurses. So many different departments will collaborate with nurses, so it is important for a new nurse to understand what all is within their scope. And this is where the mentor can come in to show them. So human resources is involved when a person is newly hired, as well as when they're in a mentorship program, so that they can switch their computer screens, if they're on Epic or Cerner or whatever it be, when they need to set up their drug screening, all the things. That is something the mentor can help with. Managers are involved since they are the ones that give the final okay on the new nurse going on their own after the mentorship program. Nurses' aides, since they work alongside the nurse and the new nurse. Physicians, since the mentor will be teaching the new nurse how it's best to collaborate with the physicians and how to communicate with them. And supervisors, especially if they're on night shift, since many managers are not present during the night. Supervisors are the ones to go to in case of any issues with policy or patients. Personal experience. So I was part of the mentorship program when I started as a new nurse over a year ago with my Michigan Health in Midland. My mentor was Sam. I did an orientation for 3 weeks with her. That was before I graduated nursing school. And then I did a mentorship program for my first 3 months as a new graduate nurse and obtaining my new RN license. This really helped me learn the feel of the unit, how to collaborate with other nurses, when to call for help for a physician, and how to accurately assess my patient, since when you freshly come out of nursing school, you don't have that critical thinking skills completely cemented into your brain yet. So it really helped having her right there behind me to bounce all my ideas and thoughts off of and questions. I currently have a mentee right now. His name is Chris. He just completed his orientation, and after the new year will start his mentorship with me. So we will do the same thing I went through. He will obtain his license sometime in the 3 months he will be mentoring with me. He will slowly gain patients in my team, and at the end of his mentorship will be taking charge of the entire team and hopefully critically thinking much stronger. So when I did my mentorship program, my health system made me complete every 3-day stretch a chart that looked very similar to this to assess the growth that I was having in my critical thinking skills, my safety, all the areas that were important to them in their mentorship program. So I would fill out the dates on the left-hand side, and then there was 3 sections. So what went well, what needs improvement, and what needs corrective. So typically they always wanted something that went well during the shift, and my mentors would fill in anything that needs improvement, such as missing IVs or improving on your bedside report or SBAR report to a physician, and things that may need immediate correction, such as attempting to draw up Ativan without saline, or something that is a safety hazard would also go in that category. I did not have any of those, but it is definitely good to have on there to track progress. So like if in this example, you can see there was something that needed to be corrected and something that needed to be improved on the first day. The second day we got better and there was something that needed improvement. And the last day there was only good things that went well. So this is a great way to track the mentee's progress through their learning in the 3 months. To talk about the nursing manager meeting that I was a part of, it was the medical surgical manager's daily meeting. It was over Microsoft Teams. It had the nursing director was heading the meeting with all 5 medical surgical managers in the morning. They discussed topics such as safe staffing, if each floor was adequately staffed or if they needed another nurse's aide or nurse that day, and how they could help resolve that by maybe offering an incentive pay. They discussed major patient events. Since it was a Monday that I attended, they talked about a couple of codes that had happened over the weekend and what could have happened, and there was another unit that had a patient fall. So they discussed the scenario and what they were going to do to improve that from happening again. They discussed other meetings planned for the day. They had another medical surgical manager meeting later in the day. That was a monthly meeting with their head of the nurses' aides to see how the nurses' aides were doing. They discussed any new hires coming onto their units, and they discussed new equipment training since we had just obtained new glucometers and they had to be QC'd differently every night. So they discussed the training and how that was going. So for this nursing organization meeting, there was many different leadership behaviors that I saw. The 2 most prominent, I would say, is transformational leadership and transactional leadership. I've never seen transactional leadership in a setting other than manager to nurse. This was the director of nursing towards the nurse managers. So that was very interesting to see how she was making sure things were getting done accordingly. The transformational leadership that I saw was when other managers talked amongst each other on how they can challenge the process that they were using to prevent patient falls to be better. They talked about gait belts and the lack of gait belt use. They talked about bed alarms and the lack of bed alarm use, since those were 2 issues in that situation. And they challenged each other to be better and to offer some sort of a video or training that the staff would have to go through now that had happened. I saw effective shared governance. The director of nursing did not bully her way and shove her opinions down in like a top-down manner. This was more of a discussion, and that was very well received by the nurse managers. So this very much taught me how to approach these type of situations, since these are things that I see in my practice. It was very well informed and everybody was very organized. That was a good meeting to be a part of. So in conclusion, there's many impacts on nursing for mentorship and nursing leadership. There is many different types of nursing leadership as seen in this medical surgical managers meeting. There is much collaboration to be done with nursing mentors and other variety of staffing. And I personally have been part of a mentorship program and have grown and will continue to teach others how to grow from it. These are my references. Have a great day.